This is a presentation on kidney stones by Emma Libby and Jennifer Girard. Case study. Richard, a 43-year-old male, came into the emergency room complaining of intense, sharp stabbing pain in his right side and lower back, accompanied by nausea. Richard informed the intake nurse that the pain had been constant for 4 hours with no relief even after taking Tylenol, and he noticed blood in his urine. Richard was admitted in the emergency room where he received intravenous saline fluid while waiting for a CT scan and results from a blood test. The CT scan results showed a 6 mm kidney stone in the ureter, and the blood test showed elevated calcium levels. Richard continued to receive IV fluids along with Gravol to help with the nausea and tamsulosin to help with the relaxation of muscles and pain. Once Richard's pain was managed, he was given a prescription for tamsulosin and Tylenol 3 to manage the pain at home, and he was discharged with orders to strain his urine with paper strainers provided and collect the stone when it passes. Richard is to make a follow-up appointment with his family physician and take his collected stone with him to get it analyzed in a lab. This is the normal function of the urinary system, or what would have happened in Richard's body had something not gone wrong. The urinary system is the body system that is affected by kidney stones. It is composed of the kidneys, the urinary bladder, the ureters, and the urethra. Kidneys play the most important role in filtering our blood and creating urine. They're located intermediate to the dorsal wall and the peritoneum. The outermost layer of the kidney is called the renal cortex. Deep to the renal cortex is another layer called the renal medulla. The deepest layer, the renal pelvis, has walls of smooth muscle tissue that contract to help move urine from the kidneys along the ureters and finally into the urinary bladder. The kidneys filter nearly 200 liters of blood every day, removing toxins, metabolic waste, and excess ions from our bodies. The main function of the kidneys is to remove these waste products from our blood and excrete them in the form of urine. By doing this, they also control how much water stays in our bodies and the concentration of solutes in that water. Oxygenated blood enters the kidneys through the renal artery, and filtered blood exits the kidneys via the renal vein. How do our kidneys filter blood? Each one of our kidneys contains approximately 1 million nephrons, which are small functional units of the kidney. Each nephron has a renal corpuscle and a renal tubule. Each renal corpuscle is made up of a glomerular capsule that contains a glomerulus, which is a bunch of capillaries that resemble a ball of yarn and that have branched off of the renal arteries. Inside of the renal corpuscle is where the first step in the filtration of our blood and production of urine occurs. This is called glomerular filtration. The capillaries that make up the glomeruli are lined with simple squamous epithelial tissue, which allows materials such as fluids, waste products, and ions to diffuse from the blood to the glomerular capsule. Larger molecules that are too big to pass through the capillary walls, such as proteins and blood cells, stay inside the blood and exit the nephron via thin vessels called vasa recta. The filtrate that is left in the glomerular capsule gets sent through the renal tubule and into a collecting duct. The second process, called tubular reabsorption, is a step that our bodies take in order to hold on to the majority of our plasma and its important contents. This step occurs either actively, requiring the use of ATP, or passively, with diffusion, facilitated diffusion, or osmosis. First, we reabsorb sodium ions to provide our bodies with energy, and then we reabsorb other ions, nutrients, and water with that energy. Aquaporins are proteins that help in passive tubular reabsorption. The presence of aquaporins means that water will be reabsorbed into the bloodstream regardless of the body's level of hydration. The simple squamous epithelium lining the capillaries allows for water and solutes to cross from the proximal and distal convoluted tubules into the network of capillaries called peritubular capillaries that surround them. From there, they re-enter into the circulation. Tubular secretion works in the opposite way that tubular reabsorption does. Instead of reabsorbing substances back into the peritubular capillaries from the filtrate, we are moving selected substances into the filtrate from the peritubular capillaries. These substances include creatinine, ions such as hydrogen, potassium, and ammonium, and some organic acids and bases. This process is important to regulate the pH of our blood, remove waste products and toxins that have used passive transport to sneak back into the peritubular capillaries or that are bonded to proteins in the blood, and to eliminate excess potassium in the body. Warming dilute or concentrated urine. The kidneys do this by using something called an osmotic gradient. Long nephron loops, such as the one shown here, are responsible for creating this gradient because the filtrate flows in opposite directions where the descending and ascending limbs are parallel to each other. This structure allows for water to flow out of the descending limb as it is permeable to water, and sodium and chloride ions to be pumped out of the ascending limb that is impermeable to water. This means that the filtrate is most concentrated when it is at the bend in the nephron loop, and at its least concentrated when it has ascended to the top of the loop to leave the nephron. When we are properly hydrated or overhydrated, our kidneys produce a relatively large amount of urine that contains lots of water and is therefore dilute. When we have not consumed enough water, our kidneys produce smaller amounts of urine that have a higher concentration of solutes. This higher concentration of solutes puts us at a higher risk of forming crystals in the renal pelvis, which is what leads to the formation of kidney stones.
What are kidney stones? Kidney stones are small, crystallized deposits that form in the kidneys. These stones are made up from high levels of waste products and low amounts of fluid in the urine. This results in the waste products not being flushed from the body. The waste products that form kidney stones are calcium oxalate, uric acid, and phosphate. People of all ages and genders can get kidney stones, but they are more common in older males. Kidney stones in the urinary system. Kidney stones are formed in the renal pelvis of the kidneys. They can stay there for days or even years. The kidney stones then move down into the ureters where they are pushed down into the bladder. When in the bladder, they move into the urethra where they get flushed out with your urine. This is a typically very painful process, but with some very, very small stones, only mild discomfort in the flank may occur. Effects from disease. Function. Kidney stones affect the function of the urinary system. They do this by blocking or getting stuck in the ureter. This can block flow of urine. They can damage the stones, which can lead to reduced glomerular filtration rate and renal blood flow. Kidney stones can also lead to a higher risk of infection, which, if left untreated, can lead to sepsis. Effects from disease. Structure. Kidney stones do not affect the structure of the urinary system, but the structure of the kidneys can increase risk of stones. Renal fusion, also known as horseshoe kidneys, are when the bottom of the kidneys are fused together and form a U shape. Renal fusion increases the risk for kidney stones. Treatment. Kidney stone treatments depend on the size, type, and position of the stones, with size being the main factor in determining treatment. Stones less than 10 millimeters in size will typically pass on their own with the help of painkillers to relieve pain, alpha blockers to relax muscles and pass the stone more quickly, and drinking water to increase fluid intake. Stones that are greater than 10 millimeters in size will typically need medical intervention. This can include sound waves to break the stones into smaller pieces so they're easier to pass, and surgical removal, which can be done laparoscopically or through a small incision in the back. Sound waves are the most common with large stones. Large stones can also pass on their own, but it is not likely. Types of kidney stones. There are 4 different types of kidney stones: calcium stones, struvite stones, uric acid stones, and cystine stones. Calcium stones are the most common, and they are formed by oxalate and calcium phosphate. Oxalate is made in your liver and ingested from food. Certain fruits and vegetables and chocolate and nuts have high levels of oxalate. High doses of vitamin D and metabolic disorders can also increase the levels of oxalate and calcium in your urine. Calcium phosphate stones are common in metabolic conditions and from taking certain medications. Struvite stones can be formed when people have urinary tract infections. These stones tend to grow fast and become quite large. Uric acid stones are formed when people have limited fluid intake or lose large amounts of fluid. High protein diets, diabetes, metabolic syndrome, and genetic factors can also increase risk of these stones. Cystine stones are caused from cystinuria, a hereditary disorder where your kidneys excrete too much of one amino acid.
In summary, kidney stones are crystallized deposits typically made of calcium. These stones are formed in the renal pelvis of the kidney and can travel through the urinary system, causing mild discomfort or high levels of pain. Smaller stones will pass on their own, and large stones may need medical intervention. Left untreated, kidney stones can lead to kidney damage, infection, and blocked ureters. Richard sought treatment immediately for his kidney stone, so he did not end up having any complications and was able to pass a stone at home successfully because of its small size. His pain was managed with the medications he was given, and he was back to normal after his stone passed. Because he had a kidney stone, he is now at a higher risk to get another one in his lifetime.